You may know the term butterfly children for those with skin as fragile as a butterfly's wings. That gentle name hides a brutal truth. For some infants with severe forms, the mortality rate in the first year is 87%.
A primary cause is sepsis. A simple skin infection can rapidly overwhelm an infant's body.
From birth, patients can face constant severe pain, often requiring powerful opiates just to endure daily life. This is more than a skin disease. We'll now show the hidden, systemic, and often fatal realities of EB to prove why awareness is a lifeline. Beyond the visible fragility, what are the immediate life-threatening dangers that patients, especially infants, face every day? The first threat is infection. Constant open wounds are gateways for bacteria, making sepsis a primary cause of early death. The second is fluid loss. Widespread blistering leads to severe dehydration, a critical danger for newborns. The third is malnutrition. Painful blisters in the mouth and throat make eating agonizing, causing a failure to thrive.
For children with junctional EB, the danger isn't just on the surface. The disease can cause devastating damage to the airways and lungs.
This means a simple hoarse cry is not just a cold. It can be a sign of a fatal respiratory complication already in progress. But the damage goes far deeper than the lungs. How can a skin condition launch such a devastating attack on the entire body? The protein defects that cause EB affect all epithelial tissues. This leads to internal blistering and scarring in the esophagus and intestines. This internal damage explains why malnutrition is so persistent. It creates a cycle of poor nutrition, weak healing, and higher infection risk. The systemic attack also targets the heart. In one severe subtype, about 30% of patients die from cardiomyopathy, even without other risk factors. For adults with severe RDEB, renal failure is a major cause of death, second only to the deadliest complication that emerges over time. EB clearly attacks the body from the inside out, but for those who survive to adulthood, a new threat arises from the chronically wounded skin.
This threat is an aggressive form of skin cancer, squamous cell carcinoma. It is the leading cause of mortality for young adults with severe RDEB.
Why does this happen? Decades of continuous wounding and healing create chronic inflammation, which dramatically raises the risk of cancerous mutations. And this is not ordinary skin cancer. After a patient with RDEB is diagnosed with their first SCC, the median survival time can be just 2.4 years. These cancers are exceptionally aggressive. Patients often develop multiple tumors at once, and they spread very early, making treatment difficult. This aggressive cancer changes how EB must be managed in adulthood. So what makes preventing these fatal outcomes so challenging? One major challenge is awareness. Severe symptoms are often hidden under bandages, making early signs of cancer or infection easy to miss. Another is the sheer complexity of care. Severe EB is incurable, demanding lifelong, daily, and painful management from a team of specialists. The challenges are relentless. Some rare forms are associated with fatal birth defects, like obstructions in the stomach. Chronic anemia from constant blood loss weakens the body, making it even harder to fight infection and heal wounds. And underneath it all is the immense burden of pain. Managing this pain is a constant, complex battle for patients and their families. So let's connect the pieces. That fragile skin is the gateway for fatal sepsis in infants and the breeding ground for aggressive cancers that kill young adults. Vigilant care goes beyond wounds. It is proactive surveillance for cancer, renal failure, and heart problems. Early detection is one of the only ways to change the prognosis. Given this relentless multi-system assault, it is clear that a lack of understanding is as dangerous as the disease itself. So what is the path forward? The path forward is awareness. The severity and breadth of these fatal outcomes demand a campaign to educate the public and guide clinicians. Awareness is not just knowing a disease exists. It's about funding research, improving care standards, and driving the interventions that prevent these tragic ends. For medical professionals, this is a call for increased vigilance. For the public, it is a call for empathy and support. For families, it is a confirmation that you are not alone.
Recall the key threats: sepsis in infancy, aggressive cancer in young adulthood, and a lifetime of systemic organ failure. This is the reality of epidermolysis bullosa.
An official awareness campaign is being launched to bring these truths to light. Share this video. Support the campaign. Your awareness can be a lifeline,